did you expect? What were some of your expectations going into this trip?
Yeah, I wouldn't say I had expectations necessarily because it was my first international mission trip, so my eyes were kind of wide open. I did have an idea that we'd see conditions and injuries that we don't normally see here.
I'm actually from Haiti. I was born and raised there, and I've been to a few hospitals shadowing my mother, who's an anesthesiologist there. And in some of the hospitals, especially the public hospitals that I've seen, there's a lack in materials and equipment, and so that is something that I expected going into this trip.
What is something that you encountered that you did not expect?
I think what was most surprising is how welcome we were by not just the staff at the hospital there, but also the patients. I just wouldn't have thought that they would put that much trust into international doctors, people that they had trouble communicating with.
Well, I definitely saw the type of impact that a recurring trip like this can have. So, you know, obviously it's great to go somewhere once and do a few surgeries that are going to hopefully help, you know, the people that you see while you're there. But having a recurring, you know, yearly trip where you're going to the same place and working with the same people, you really have an opportunity to grow relationships with people down there and really teach them something that you can hopefully make more sustainable in the long term, that will change the care for when you're not there as well.
If I were to go back on this trip again, hopefully I, along with my colleague, we could bring a portable ultrasound machine and be able to perform blocks there, and also teach you know, the anesthesiologists in Haiti, the attendings as well as the residents, to see how to perform blocks, and then they could, you know, continue doing blocks even while we're not there.
I learned that as physicians, we should always go back to the basics. We have been so endowed with all the equipment and monitoring, and at times we've treated a number because all the monitors that are available to us can tell us information. In Haiti, we didn't have monitors. In Haiti, we didn't have numbers. And so what we had was the patient. So we looked at the patient and we evaluated the clinical situation. Back to basics.
When you're in the US, you are constantly trying to figure out the latest technology or use the latest implant. And when you're in a place that you don't have the latest technology and you don't have the latest implant, you instead go back and you focus on the fundamentals and the principles of orthopedics. And this kind of trip makes you do that. It makes you appreciate and understand those things that we all should know.
To be innovative and also to be creative, because there's not a lot of supplies there, so we make use of what's in front of us.
In Hôpital Adventiste, we were actually able to perform blind blocks because they don't have ultrasound machines in order to perform, you know, like peripheral nerve blocks.
It was hardware removal on a tibia, distal tibia fracture, and with many instruments ready and you know, ready for the case. And as they went in, I remember they saw screws that were just, you know, regular Phillips screws. We just needed a screwdriver, and Dr. Scott Nelson actually went out to his truck and got a screwdriver. We then autoclaved it and continued with the procedure.
What had the biggest impact on you?
I would say seeing the pretty stark differences between medical care in the US versus elsewhere. I think to some degree we get a little bit spoiled with the amount of access that we have here, and you start forgetting what it's like in other areas of the world.
I think it really, you know, stood out to me the impact that something small that we're used to treating here every day, like a clubfoot, you know, in an infant, or a supracondylar fracture in a young child, you know, what can happen if those go untreated for, you know, most of that child's life or childhood, and the impact that that can have on their life.
The U.S. here, and as a resident, it's really easy to get caught up in all the minutiae. It seems like every year there's more paperwork, there's the health insurance, and so you lose track of the reason you really chose this profession in the first place. And then you go to some place like Haiti where there's none of that, and there's just a group of people that are really working together to try to help this individual get the health care they need. And it reminds you why you wanted to do this in the first place.